media conference. My name is Michael Hurley, and I'm the president of CUPE's Ontario Council of Hospital Unions. And this is Doug Allen. He's a senior research officer with the Canadian Union of Public Employees. And we're releasing numbers this morning in terms of the numbers of beds and staff that need to be added both for the City of Toronto and for the province of Ontario to deal with the capacity crisis on the bed side and on the staffing side in Ontario's hospitals. Just to give you a sense of the proportion, Ontario having the fewest number of hospital beds, acute hospital beds of any province in the country, fewest in any developed economy. Last year, 2,096 people died on waiting lists for surgery in Ontario hospitals, and we had another 9,400 patients who died waiting for MRIs and CAT scans. We had 145 of 250 ER closures happen in this one province last year. And we have a hospital system with 270,000 employees on paper, but 37,000 vacancies and an attrition rate of 12%. We have nowhere near the capacity that we need, and we're going to talk about that at length this morning. Over to you, Doug.
Thank you, Michael. The nature of the crisis, inadequate staffing. In provinces outside of Ontario, there are 18% more staff per capita than in hospitals in Ontario. Much of this is due to low inpatient services. As you can see here, we're missing 16,245 nursing and inpatient service workers, but it's throughout the whole sector. We see support services down 8,131 employees. Also true in intensive care, minus 715, operating room minus 2,310, emergency rooms 1,883 fewer staff. The shortage occurs despite the fact that Ontario hospitals play a bigger than average role for research, education, and others, as befits a rich, large province. In total, we're missing 33,778 full-time staff, full-time equivalent staff, compared to the other provinces. The staffing levels, instead of improving, are getting worse. Statistics Canada data suggests there's not been any real improvement in Ontario healthcare since staffing since before the pandemic. In fact, we're down from a previous high of 271,905 hospital staff, and we're now down to 267,115 hospital staff according to Statistics Canada. That has not been made up for in any way by the other two healthcare subsectors, nursing and residential care, and ambulatory care. Both of them are also down from previous highs. There's been no significant attempt to improve the capacity of our healthcare spending. And I want to be clear on this because the government sometimes refers to hirings. Hirings are not the useful metric. The useful metric is the total number of staff that are actually working in the sector, because people are fleeing the healthcare sector because of the difficult working conditions and the attack on wages from the provincial government. There, in fact, has been a long-term decline in the spending by hospitals in Ontario on compensation for employees. We're down from a high, and you'll see this on page 5 of the brief, from 64% of hospital spending on staff down to 59%, a significant decline. This is not something that is inherent to hospitals. It's just something that has occurred in Ontario. The rest of Canada has seen staffing compensation increase from 65% to 67%. There is a large, large gap between Ontario and the rest of Canada. There is also a very significant shortage of hospital workers. job vacancies in hospitals have grown dramatically. Right now, for the service and support staff at hospitals, there's 5,161 service job vacancies. That is almost triple the rate that existed in March of 2018. Very similar dynamics for nurses. For example, for registered practical nurse positions, they have a vacancy rate of 11.89%, even higher than the support service staff of just over 10% job vacancy. The RPN vacancy rate is now more than double what it was when this government was elected. More than double since this government has elected. And in fact, Statistics Canada data takes the data back even further than the hospital data does. It goes back to 2015. We can see that the number of job vacancies has actually tripled since 2015. We started at a sort of a normal level of around 5,000 job vacancies in hospitals. We're now coming on very strong to just under 20,000 job vacancies in Ontario. The problem is not getting better. In the rest of the economy, we've seen a significant drop in job vacancies over the last year. 18% drop in job vacancies. In hospitals, it's gotten much worse. We have seen a 19.3% increase in the number of job vacancies on Ontario hospitals. That's an increase of 4,000 job vacancies. What are the consequences? Very significant closures of ERs. This is a totally new phenomenon that's afflicting rural and small town Ontario. As Michael mentioned, 145 closures documented by the Financial Accountability Office in 2022. These closures continue with hundreds more in 2023. Carleton Place, Hawkesbury, Walkerton, Arnprior, Listowel, St. Mary's, Clinton, Durham, Almont, Seaforth, Mount Forest, Chesley, so far this year. And of course, we've had the permanent closure of the Minden emergency room. Very troubling prospect for the future of rural Ontario. Presumably, this would be the base of the Ford government, but instead, they're seeing healthcare in that sector erode very rapidly. The government ran on almost no promises in 2018, but the one promise they did say was that they would end hallway healthcare. In fact, it's much worse now. There's been a 22% increase in the number of people who are being treated in hospital hallways. We're at a record high of 1,289 patients being treated in hospital hallways. Complete failure on that front. Surgeries, even when the hospitals weren't restricting admission in 22-23 due to COVID, surgeries are far down from what they were prior to COVID. We're now at 4,523 fewer surgeries per month than in 2019. 4,523 fewer surgeries. That's 8.4% fewer surgeries than in 2019. Surgical wait times in 2022-23 were 49% longer than prior to the pandemic. 107,000 patients are waiting longer than the maximum clinical guidelines for their surgeries. That's an all-time high. But for all of these phenomena, instead of a plan to deal with that crisis and to solve it, we have a plan from the provincial government, from the Ford government, that will make it worse. The government's plan over the next decade is 3,000 new hospital beds. That's an increase of about 8.4% in nominal capacity, about 0.79% per year. This will mean a sharp drop in service levels given population growth and aging. The nominal increase will not even come close to covering off increased demand for services due to population growth. which will be, according to the Ministry of Finance, the Ontario Ministry of Finance, about 15% over that same time period. It's about half of the actual population growth, but it gets much worse. As you'll see on page 13 of the brief, healthcare is very sensitive to aging, and our population is aging rapidly. The over 65 population is growing at twice the rate of the normal population, and this will drive need for hospital and healthcare services very significantly. Worse, the oldest parts of the over 65 population, the plus 75 and the plus 90 age groups, are growing even faster, even faster. The plans by the provincial government and for the immediate future are only for 1,000 beds over the next 4 years. That's even worse than their 10-year plan. Aging has not been planned for decades, and that's how we got into this capacity crisis. It's become much more apparent in the last few years. It should be planned for now, but it's not. The plan is to double down on the hospital capacity crisis and make it worse. Our estimate of what is needed to deal with the aging and capacity crisis, based upon the growth in the over 65 population and the overall and the under 65 population, is a need to increase capacity by 9% over 4 years. 9%. That in itself is 3,288 beds, more than 3 times what the government has planned to do. But that 3,288 would only just keep pace with capacity, and keep capacity at the same crisis level we have now. We think it's entirely reasonable that the government plan on an urgent basis to improve the capacity of our healthcare system by adding staff. We think this can be done at a rate of 3% per year. And based upon that estimate, we see the need for a 22.39% increase per year over 4 years, combining both aging population and an attempt to end the capacity crisis, or at least to ameliorate the capacity crisis. That means for Ontario, we need to add an extra 60,000 hospital staff over the next 4 years and 8,170 hospital beds. For Toronto alone, that means 2,268 added beds and 11,961 staff. So far, we see no attempt by the provincial government to move on this or to even recognize that they have an urgent problem that needs to be solved. I'll turn it back over to Michael. I did, yes.
This gap here between what the government has planned and what is needed plays out as personal tragedies for Ontario families every day. We have people pushed out of hospital while they're still acutely ill. We have people who can't get into hospital. We have people dying on waiting lists. We have emergency departments going down. We have a government that has no plan, even though the enormity and severity of this crisis has been apparent to everyone in Ontario for some time. And, this also plays out in terms of the workforce, because the staff in Ontario hospitals are cracking under the weight of this tsunami of an aging and growing population. And when you layer on top of that factors like COVID, RSV, flu, then you have a system which had no excess capacity to begin with, stretched to the breaking point, and you have staff who realize at some point during their working lives that no matter how hard they work, they can never, ever make up, even though they work through their breaks, even though they work through their lunches, which they always do, without pay, even though they stay late, even though they pick up every overtime shift they're asked to, even though they work all the extra weekends that they're needed to, they will never ever be able to make up the shortfall between what the Ontario government provides to hospitals in terms of staffing and beds and the need of the population. They will never ever be able to deliver the quality of care that they were trained to, and a lot of people give up in despair. They just can't do it anymore. They're emotionally, physically broken by the demands of working in the Ontario hospital system, and that's evidenced by the outflow of staff in Ontario hospitals. 5 unions representing the workforce in Ontario hospitals wrote the Premier last July asking for action to deal with the emergency department closures, to deal with the shortfall in beds and the crisis that this capacity issue was causing for Ontario families. We've heard not a word. Not a word from him. He never responded to us, nor has his government come up with a plan in terms of addressing the shortfall. Today, we're calling on the Ontario government to make these investments. Otherwise, the crisis in the hospitals will worsen as we go forward in time. What the government is looking at here is a solution that takes them to the end of this term and leaves a hospital system in disarray in communities across this province. We are one of the wealthiest jurisdictions in the world, and we can afford and we have a moral responsibility to provide quality care to the people of this province, and we're calling on the government to do that. So there's many of you here, so perhaps you could put up your hands if you want to ask questions. Thank you very much.